Okay, guys, today we are going to talk about the most important key points about opioids as related to PMC exam. So let's start. The first drug we can see here: morphine, heroin, mepridine, methadone, nalbuphine, and paroxetine. And antidote we can use as naloxone. And here we can see loperamide, diphenoxidate, codeine, pentazone, buprenorphine, fentanyl, and pethidine. And these are the drugs we use for relief pain. And what kind of a pain we use it for? We use it for neuropathic pain and nociceptive pain. So let's start it. And now we can see here morphine. Also we can use it for pulmonary edema, and also it's also a drug of a choice for myocardial infarction. And here we can see what the opioids mostly do. It can cause pupil constriction, severe pupil constriction, that called meiosis, and also it can lead to constipation. So let's lead to here mechanism of action. On the muscular receptor, it affects as muscular agonist, except the one drug that called mepridine. You can see here mepridine. What the mepridine does, it used as antagonist. Like I talk about, most of the opioids, what it does, it can cause constipation, but these drugs can lead to diarrhea in the patient. And another receptor, opioid receptors. And there are three kinds of receptors. We use mu receptor, cap receptor, and delta receptor. The most of the opioid drugs are effect on mu receptor. So let's discuss about it. Mu receptors on the GIT tract can lead to constipation. When it affects on the mast cell, it can decrease the histamine release in the lungs. And that's why we can use these drugs, morphine, vancomycin, and tibutramine, for decrease the pulmonary edema. And when there are some mu receptors on brain, so what it affects on there, on the cerebral cortex, it can lead to euphoria, happiness, and overdrug can lead to coma, confusion. On the brain stem, it can lead to respiratory depression. And when it will go to respiratory depression, what it will happen, decrease the respiratory rate, that leads to hypoxia, it leads to hypercapnia. Hypercapnia, what is hypercapnia? Is a high concentration of carbon dioxide in the body, and high concentration of the carbon dioxide can lead to respiratory acidosis, cerebral vasodilation, can lead to headache, and these all can lead to one thing, respiratory type 2 failure. So if the patient comes with low respiratory rate, we can see that he has like over drug with these things. And when the patient will come with the high respiratory rate, mostly happens because of COPD, chronic obstruction pulmonary disease. So now we see here on the CNS, on the brainstem, what it will do, relief pain, like I talk about it, and decrease the cough, what we call it, and tussive effect, and lead to vomiting. On the spinal cord, it can relieve the pain, and what we call, when it relieve the pain in the spinal cord, we call spinal analgesia. The indication on the biliary colic by mepridine. On the pulmonary edema, we can use morphine, antitussive effect we can use. And when there is a lot of severe diarrhea, we can use loperamide and diphenoxylate to decrease the diarrhea concentration. And these are the pharmaceutical name we can see here: amodione and lometil. And what about analgesic effect on the pregnant woman? There are special drugs we can use for Nepridine, and pethidine we can use for the pregnant woman. The side effect: pupil constriction, meiosis, hypertension, euphoria, low respiratory tolerance, except eyes, because you can see in the patient pupil constriction, meiosis, whatever happens. And if the patient come with a high concentration of drug like heroin, like codeine, so what you're gonna do to withdraw the symptoms, you will give benzodiazepine to withdraw these symptoms. So now let's talk about the contraindications. And there are a few contraindications. All the opioids contraindication in the colic except mepridine, because it can lead to diarrhea. It affects on the GIT tract, and head trauma. And contraindication to all pulmonary pathologies except pulmonary edema. And now we can see here it affects on the liver and renal failure. It will decrease the thyroid and adrenal insufficiency. And when there's a low concentration for thyroid gland, what we call hypothyroidism. For adrenal, we can use Addison disease. So what about if the patient comes to you with a high concentration of heroin and you want to make him withdraw the symptoms? What we're going to use? We can use mu antagonist drugs. And there are a few antagonist drugs we can see here. Pentazocine, and the pharmaceutical name is Susigan, and Nelbuphine, the pharmaceutical name is Nelpin. We can use these drugs to withdraw these symptoms in heroinic patient. So these are some key points you have to know about for the PMC exam, because these are really important. So guys, this is for today. Thank you.